also a former secretary of the Agency of Human Services. So he comes with tremendous credentials, and I wanted to give him an opportunity to come before the committee and talk to us about potential tweaks, improvements, whatever, in the operation of AHS. That we don't have a bill that's active right now, but anyway, welcome in, Doug, and let's go around in case you. It seems like you know everybody, though.
Everybody here. Yes, I probably don't know Senator Whitehouse very well. I think we just met once
I think so.
at Five Corners in Essex, waiting cars during the campaign.
Oh, wow.
Oh,
You guys go sideways too, huh?
Yes, we do.
Yes, we know.
Okay.
Senator Morley and I found each other, but we know each other very well. Of course, I know best is probably Senator Clarkson. So
Which is great.
always wonderful.
And we've seen, actually, we saw Doug in most recently, I guess, in September.
Yeah.
Well, welcome in.
Thank you, Senator Palmer. I really appreciate this opportunity and your interest. We went back and forth in communicating about some of my concerns I want to express here today. But I appreciate that the committee's going to take some time to hear them and perhaps help the Agency of Human Services with an ongoing project. You gave my introduction of what I've done. Probably the work with as Secretary of the Agency of Human Services is most relevant right now. But I also, during that time, I worked a lot with my national organization, my peers, the American Public Human Services Association. So a lot of what I learned about human services management delivery, I learned by listening to my peers who have been doing it a lot longer than I have. And after I left the agency, I continued working with them and helping them with conferences and presenting, mostly around what I want to talk to you about today, which is the integration of services, breaking down silos within the agency, and how IT properly used, properly developed, can facilitate that. There is a major modernization program going on with IT in the state of Vermont. We're spending tens of millions, if not more than that, on it, and it's long overdue. I mean, it's when I was there at the agency, most of the IT was 30 years old. Well, it's been 12 years since I left, and a lot of it is still there. Think Space Invaders, and the Pong or whatever the games were, the first video games that came out in Mars. It's really old technology. And the project underway is a bit about that. I think they're doing very well from everything I've seen and heard. And I talked to a consultant who worked in the state back when I was secretary, who worked on these issues about IT and delivery services at the agency. And that's what he does. He's a consultant. He works with states that are trying to make optimum use of their IT technology. He's very impressed with what the state's doing. But there was one missing element from his point of view, and all the public documents that he read and that I've seen, it's really not clear that there is synchronization between the Agency of Human Services and the Agency of Digital Services. And that's what I want to talk to you about today. The state Agency of Human Services works in silos, so does state government, and so does the legislature, because these sorts of issues can get discussed in a variety of committees. And what I'm here to do it today is try to get you to focus on the intersection, which to me seems perfect for government operations, because it's really about the operations of state government. The opportunities are possible savings. We spend a lot of time on bureaucracy. Money that could better be spent, and time better could be spent serving the clients of that agency. Certainly better outcomes for the people who are receiving services, because there's often a lack of connection between different programs and the services that people are providing. That's the problem with silos. It also allows for greater accountability. Because you can get better information out of an upgraded system. There's an article in 7 days recently, about that very issue that children might be in danger because DCF's system broke down and they really couldn't communicate. So in terms of helping the stories have been about the legislature not getting information it needs. I think one story focused on the education agency. Well, it's across state government, and better technology produces better accountability, better information, and allows the legislature to have all the information they need to make good decisions. I also want to mention that I understand the secretary's not going to be here today, but I talked to one of her staff people, and I think they're listening in today. They suggested they want to hear what I have to say, and I had a very positive conversation with Ed Fisher, who was principal assistant to the secretary. I was greatly encouraged by what's going on. I started off asking questions, and then I go, is it really as good as it looks? And I think it is. But
Senator Bielski.
Yeah, I have a question. I mean, it may not be for you, Doug. It may not even be answerable in the room, but I know that the state is on a bit of a technology update plan, sort of generally. And I'm just wondering if anybody in the room has a sense of where we're at in that process. Because I agree with you. The technology is deeply in need, and we would do a lot better if it was properly updated. But I just don't know if anyone in the room knows like where we're at in that process.
Well, AHS and the Department of Labor have been on sort of the same time track. I mean, both very antique systems. DOL's is going live to change this spring.
So DOL
So
is not on
DOL
hold
is
anymore.
DOL is finally going to be modernized with it's going to be all up to date. And I thought AHS was on the same time frame, but we should obviously get them, and we should get ADS in here to testify.
Yeah.
For all the different departments and agencies are.
I would just, with the AHS being such a massive part of state government and we rightfully spend a lot of money on those services. I would think that we would want to kind of prioritize their update. Labor reports, I mean, they're all important.
They really are all important. As we discovered during the pandemic, and a number of people filing unemployment and what happened, the whole breakdown that which was just symptomatic of outdated IT. I mean, you don't expect something as big as the pandemic and the impacts of the pandemic, but we were woefully prepared for it. There was also a problem in the Department of Children and Families distributing childcare money. There was additional money for that, but it came with a lot of regulations, and it's okay. But a lot of overtime was needed from workers across that department to make contact with the daycare providers. It was a paper process. They were calling them and saying, "How many children do you have? What are their names? What are their ages? How do they qualify?" They put it into, in Montpelier or Waterbury, wherever they put it into the system. And then 2 days later, the system they needed a new spreadsheet. So they did the whole process all over again. So probably hundreds of thousands of dollars of overtime money was spent because we didn't have IT systems that could handle the extra work that was required to distribute the money for childcare. Point was, it should have gone to childcare. And because of the technology problem. So it's obvious, I think, to everybody that we really need to upgrade. What I'm hoping to do today is to encourage this committee and the legislature in general to provide oversight of these, just to make sure it's being done in a coordinated way, and to provide support to the folks, particularly right now at AHS, who are somewhat dependent on the work that the Agency of Digital Services, the DDS, is doing. And I don't know the answer. Okay, it could be everything's fine, but I don't know, and I don't think anybody else really knows. So why did I come to this committee? First of all, Senator, you've listened to me in the past about issues in the within the Agency of Human Services, and I appreciate that. To me, this committee, over the years that I've been in this building, and your counterpart in the House have really been undervalued because these are important issues, and legislature can pass good policies, policy committees. They can be funded in the appropriations committee, the taxes can be raised across the hall. But the policy needs to be translated into good practices. And that's not always the case. And given the nature of our legislature, being a citizen legislature, part-time, understaffed, it's very hard to do oversight of whether the executive branch is actually accomplishing the purposes stated in the legislation passed in this building. And they're all busy. You know, we talk about AHS, well, certainly there's the committee down the hall, but they've got, you know, their bills on the wall too, and there are crises that have to be dealt with. And coming around to saying, well, we passed, you know, XYZ legislation 3 years ago. How's it going? We don't ask those questions. At least when I was here, we didn't ask those
Yes, we
questions
do.
as often as in my experience, Senator Revere, we didn't ask those questions, and I was chairing the committees. I would remind them of that.
I wonder, and I know you're here to specifically talk about DHS, but this brings up another tweet that's really near to me, and that is government accountability. And the legislature is supposed to be a separate but equal branch of government. And so I wonder if you have any thoughts on ways. I think we have done some work to try and build some of those questions being asked, and yet we have rules that aren't being promulgated. We have reports that are being done. And so I wonder if you have any thoughts about how we could increase that accountability, given the construct of the current state of affairs.
Just to add on to that, because one of the questions government accountability asked every committee to be asking is, how are you measuring, you know, how are you reviewing that data, you know, all of those measurables, which we've really focused on, I think, as legislature in the last 10 years is really.
But as you may
That's
recall,
correct.
we did put forward a bill from our summer government accountability group that didn't pass. And so I'm really trying, I welcome your knowledge and expertise in this arena, and really would love to, you know, if you can't answer on the fly, I totally understand, but I do want to build that accountability.
From what I saw on the website, there's no more government accountability to try to government accountability committee. I think to answer your question, that's a possibility. But those joint committees have a real hard time meeting. That becomes the issue. And even when a committee focuses on it, I think the Agency of Human Services, which I'll speak to, is somewhat hamstrung because it's hard to produce the information that the legislature wants. When I became secretary of that agency, and the senator was asking me to show results of to identify every single program in the agency, who's on it, who's receiving services, how much money is being spent, are we making lives any better? Folks couldn't produce it. It just you couldn't get it out of the systems that we had. So while the effort was there, I think that it was limited in its effectiveness because of the lack of information. So we just sort of keep on going. I would like more oversight when I was secretary of the Agency of Human Services, because then it would have given me an opportunity to talk about things that we weren't doing and effectively, but why. And the why always came down to technology, staffing levels, and just the resources we needed to develop good business practice so we can actually do what the legislature asks us to do. I didn't get asked that very often. I go into an appropriations committee and say, we requested 3 IT positions. Well, why do you need those? There wasn't a whole lot of connection between the two branches. And I think, you know, the two branches, sort of getting into political theory here a little bit, but the two branches need to work better together in my view. It's you know, I've often said when the founders put our Constitution together, there were checks and balances in there. There were no political parties. It wasn't between 2 parties or 3 parties. It was between branches of government. And I certainly felt that when I went to the Agency of Human Services and would go into committees. It was more of an interrogation than it was a partnership. And that's what I'm hoping maybe what I'm proposing is more of a partnership on this particular project with IT.
May I just have another question? So
Government accountability hasn't been renamed.
It doesn't exist
It doesn't
anymore.
exist.
We got rid of it.
Yeah,
Just
To my objection,
no, I recall.
3 years
We
ago.
have a government oversight committee.
No,
We should have
no
a
kidding.
government oversight.
No.
Why?
We
Why
not,
can't we establish it?
we could. We sunsetted it 3 years ago, again, to my objection. I
The
think
accountability, not the oversight.
the government, yeah, the Government
Yeah,
Accountability
I know.
Committee was sunset 3 years ago.
Remember when Diane Stalin
objected.
was so keen on?
Instead, what we did to somehow make me feel better was we did the summer government accountability study, and then we promptly ignored all of their suggestions.
And was one of them to establish a government?
It was
Oversight
with
committee.
much more parameters and a bit of a shift, and I can go find the bill. Actually, I think the bill that came from the House was garbage, but I could go find the report that came from the committee. And we can circle back to it. Cause I think it's important.
Because just saying, if we wanted to think about reestablishing that, and as a committee bill, just censure on our deadline for committee bill introductions next Thursday.
Can any member of the committee? For committee bill introduction on the floor or in the committee?
It has to be introduced, it has to be introduced and sent to it has to be passed out of committee on Thursday. It can go to the floor, no, but, and then then it will be sent back to committee for work. All they're doing is getting the committee bills established in drafted principle, and then they are sent back to committees to work on them.
Because I'd be more than happy to introduce language and do that process if that's something the committee wants to work on. It's also helpful information for something I want to do in judiciary.
I'll just add as a sort of historical note, I was chair of the GAC committee at one point,
Yeah,
I made
that's
a
right.
Townsend,
Yeah.
once upon a time.
I remember that.
And the composition of that committee changed yearly because people that were on it, with all due respect, my impression was it was their least favorite thing to do. They didn't really want to be on it. They didn't really want to meet. We had Sue,
No, Pat
McDonald's sister.
McDonald's sisters and Q.
She was in the administration anyway. She was part of the makeup. And if I'm mischaracterizing anybody's feelings, I apologize, but that's what I
I
remember.
think that's fair.
We had Anthony Polina on it for a while. We had Dick McCormick on it for a while.
Jeanette for a while.
Jeanette was on it for a while. And we had
Linus Nelson.
indicators that we used to have this big, huge dashboard. And
Yeah.
we'd be able to look and see how much we're spending. Were people any better off because we were spending that money, all that sort of stuff. And it seemed to be a committee that just kept meeting, but never really did anything, sort of. We changed the indicators every now and then, and anyway, and if you're wanting to do that, I'm fine, I guess, with that. I don't think you'll have a waiting line of people that want to be on it, but I could be wrong.
You mean on the government oversight committee?
It's called accountability, not oversight.
No, but I think it actually could be renamed as a government oversight committee.
Well, it would come with different charges, I think.
So the summer working group that probably started meeting in December as we do. They put forward some specific recommendations for how to reconstitute that committee with a slightly different charge and some parameters that I would probably just grab
Right.
that and
We start with that.
We could certainly take a look at it. I just had questions, just kind of on a personal note. Jane Kitchell was also secretary at one point. Did you succeed her or were you there before? How many people were also employed by, because the Agency of Human Services is the biggest agency in state government right now. And I don't know how many employees are there, but it seems like there's a lot. And I don't know whether it's a function of the legislative process getting better and reacting to people's needs more nicely, or whether it's like a lot of other things, it just keeps getting bigger, but it really doesn't change anything, sort of.
When I was there, it was about 4,000 employees. over 1,000 of them were in the corrections department. So that tends to
Oh,
skew.
that's right. It is part of it.
Yeah, it's an unusual arrangements. I think it's a great arrangement.
You do.
Absolutely.
Okay.
And I'll get to that a little bit.
All right.
But yeah, I'll address corrections in a moment. But after Senator Kitchell was the last secretary under Governor Dean, and then Governor Douglas was there for 8 years, and there were 4 secretaries. And then
Which tells you a lot in and of itself.
it's the lack of continuity.
Yeah.
Yeah.
Exactly.
I mean, it's going back to the Government Accountability Committee. That's when I think the speaker and the pro tem both were really focused on results-based accountability.
Yeah.
I remember that phrase.
Remember,
And-
Obie was passionate.
Yeah, but when the leadership changes, it's not the same priority anymore. And the same thing goes on in the executive branch.
Yeah.
I mean, the lack of continuity is a problem because secretaries come in with different charges. Sometimes the governor can set the agenda no matter who the secretary is, but realistically speaking, the governor doesn't pay that close attention to the functioning of every part of state government just by virtue of the job. Anyway, I think it's unfortunate that there is no accountability committee anymore. When I started in that agency, that we had come through the previous administration, the challenges for change operation, which was agreed to by the legislature. And basically it was cut for the Agency of Human Services, it cut $25 million out plus the matching federal money without any change in processes or anything like that. And the challenge was to do a better job. But coming with that, were a whole lot of accountability measures. And there was a requirement that that my agency submit a quarterly report to the legislature on progress made and outcomes and all of that. I had one full-time staff person who did nothing but that. I was trying to get the information because of the IP. And I don't recall any legislative committee ever looking at those reports because the leadership had changed and so on and on. You know, that's just, it's just the way government works. And the challenge is to try to figure out how to make it work a whole lot better than it does. There's no one person's fault. It's not partisan. It's not political. It's just functioning. It's functioning fine. It's a big organization.
Yeah.
But it can be made better. And that's something that I firmly believe. Governor Shumlin gave me the charge of breaking down silos, and that's what we're working on. We got interrupted by Irene, which closed down, which all of a sudden shifted 2,000 people into temporary offices. My office was in the back storage room in Williston for 3 years.
After Irene.
I missed going into the new building by about a month. It's totally crazy. I've been so involved with the design of that building and the size of that building. And you know, said I'm a bit like Moses. I was trying to lead us to the promised land, but I didn't get to see it. So anyway, it was.
Well, hopefully
I
you just didn't get work to work.
didn't get the work in this. I was. Anyway, the point of IT for me is it's a tool. It's not a policy. It's not a program. It's a tool. And my dad always used to tell me there's no job you can't do if you've got the right tools. And the agency has not had the right tools. And I think what's going on right now is the agency a lot of the right tools, but not all of them. And what I hope they're doing that I haven't seen that I'm talking to folks about today is developing this IT in a way that allows that integration to occur. The agency is still focused on it. And Mr. Fisher, I talked to yesterday, assured me that they got there's a report which I'm going to get to, which has come to this committee along with health and welfare and your House counterparts. That talks about integration. Integration is all the way through. The fact is, we need to build our programs around families and become silos. And I had a nice illustration when I got there when we were starting to talk about integrated IT. Is the silos are there. There's Department for Children and Families, and then their different programs. They all have their own IT systems. Then there's Dale, and then there's corrections, and then there's mental health, and there's nothing tying them together. And the challenge is to build the ITs. So I'll tell you how little I know about IT, but in theory, you build a platform underneath it that supports them all. And underneath it is all the communication, all the data, all the data that people do when they apply for one program, it sits there. If they apply for another program, the information's already there. So
You don't need to be creative.
you don't have to recreate it. There is the potential there. It's being done elsewhere in the country by other states. Vermont, I think we were on that track, and I guess they've continued on it. But I think it's really it's gotten a lot of energy because with the potential of this IT project. So the underlying question is, are they working together? I don't know if I can convince you about the value of integration, but I came across this document, 10 reasons why you and your governor, that this was addressed to people like me when I'm serving in that role, why states should be integrating their health and human services business processes, because that's what we're being about. And it says it all. I mean, I could read through it, but
This isn't on the.
I didn't get that.
Because I did get this.
No, I did. No, I did not. I came across this. I was going through all my, oh yes, sorry. It's somebody typing me.
I have another one.
Okay.
You would like.
But anyway, it's, and the first thing is the opportunity. We got 90-10 federal money to do this because the federal government is fully involved with trying to integrate health and human services, recognizing the social determinants of health and all those other things.
Meaning work.
Yeah,
Are they?
they still are, they have full of money. So they are urging states to, develop the IT to allow integration of health, Medicaid, and all the various human services programs. As far as we know, it's still going on, amidst all the craziness in Washington, and all the cuts. It seems like these efforts are continuing. Certainly when I talked to Mr. Petrus, who was the consultant that we used, he says the money is still there and the encouragement is still there from the Centers for Medicaid and Medicare Services. So it's being developed. And then I don't know if you received the other piece that I sent.
We have
Two documents. Okay, you got both of them.
Yes.
The other one is,
Oh, did we have another
it
one?
gets into the
Yeah.
weeds, but it's the Integrated Health and Human Services National Trends. The first two pages are interesting. After that,
About 100 pages long.
you can get into the weeds, but it makes the case for full integration and developing the IT systems needed to make that happen.
Senator Morgan. Doug, so I'm on the healthcare committee too, and I know that a lot of the rural grant coming in is to help, a lot of it's to streamline, right? And it's on IT, it's the EMR systems and all that stuff. You're not, this is a separate bucket of money coming in?
I think I don't know. I don't know if they're blended or they're separate programs. I get ADS people then because that's where the funding being spent. So I don't know the answer.
It'd be great if there was two different funds coming in, the rural dollars, which is about 195 million for 5 years, one-time dollars.
Mhm.
And then the 90-10 of this would be wonderful. Because AHS, I agree with you, needs to keep up, along with the hospitals and everyone else, and if they can all get linked together.
It's not an easy problem to solve to keep these together. The hospital's been working on this for a long time. And it's very difficult. You run into HIPAA issues, which can be overcome, but it's not easy. I'm not here to be critical of anybody. I think it's just there's an opportunity out there that I hope is not missed. And I will say, from my perspective, integration works. And I go to the meetings with my national groups, and they were talking about all these best practices and integration. They've got something called a value curve, how agencies can modernize one step at a time and all of that. And I walk out and say, I've got to go back home and transform that agency. And I go back, sit at my desk, and all these other problems were coming in because mostly what you deal with in government, you do it in the legislature, or we did it when I was in the executive, is crisis management and thinking ahead and trying to develop better ways of dealing with new problems and developing problems. Opioids were not the same issue 15 years ago that they are today, but all those issues land right in the Agency of Human Services, and they're using the same IT and the same processes there. But so when I came back, I realized you can't transform the whole place. The last administration that really tried to do major reorganization was the Cunit administration. And it was took 5 years for the agency to recover because they reorganized all the boxes and changed the stationery. We had the print stationery then. It was just so I couldn't go back and say we're going to transform this agency. I did an internal document, so I never said it out loud. Tried doing one issue at a time, and the opioids came up. And Governor Shumlin pointed at that one year. People recall focused his whole state of the state address on that. Out of all that came Hub and Spoke. Hub and Spoke system, which has been very successful. I don't know if it's still successful or not.
I understand it still is.
It still is.
It's your work.
The hub and spoke system is still in place, I think. And they do great work, but I don't know that it's the holistic picture of,
It's
all that is needed.
it's
More it's needed, but
it's all that's needed. It depends on resources too, and policies and regulations and that. But what was going on at the time was the health department ran the methadone clinics, and DEVA through Medicaid was funding buprenorphine in doctors' offices, and you're dealing with the same clients, and there was no connection between the two. And if you remember Barbara Samaglio, who was the deputy, she came into my office early on and said, we have an opportunity to put those two together and develop a new program that integrates health department and DEVA and other parts of the agency around the opioid problems. So people were going into methadone, getting methadone, going away, and we weren't getting at the root causes. And to get at the root causes, you got to do an assessment, and nobody's responsible for doing the assessment. What do people need? Do they need housing? Do they need a job? Do they need mental health services? Or what kind of services? So the whole idea was to use the Affordable Care Act money, otherwise known as Obamacare, to blend those two programs and develop the hub. And then these folks would go out to housing or job training, a primary care provider, and all of that. But that's a good example of what integration can do. It was difficult to do. Funding was to do it was difficult, but we did have a grant from the federal government that enabled it, and we built it, and it's worked. I mentioned I was going to conferences. I went to some for sponsored by the National Governors Association, their best practices unit. Never saw a governor there, but it was for staff, and we made presentations there several times because it was considered a model. Kentucky had a model and we had a model, but it shows the value, to me, it shows the value of integration. Another integration effort we made was around home visiting. We had health department nurses visiting homes, and we had children and families through, mostly through our parent-child centers and other community partners. They were visiting homes, but they were going separately, and they were looking at different things. And oftentimes they would make recommendations to the family that would contradict each other. And that's, and so we integrated those. That was a tough integration to happen, but it's more difficult if they can't share the information. And that's why what I've been talking about. So I think the opportunity is there. The federal money is there. The federal departments are aligned with what we're trying to do. And I think there's a real urgency to doing this too. And I would urge you to take on that sense of urgency. Um, we are about to lose, as everybody knows, a whole lot of federal money in this arena. And based on only what I heard from the governor yesterday, it sounds like the impacts can be ameliorated in this coming year. What happens after that is a big question mark. And I think it's going to call for some major changes in how government operates. And it could involve tax policy. It could involve, obviously the budgets, but it should involve management, because to adapt to it, we need more efficient government. People want, I think citizens want government to work. People have different political views, but the bottom line is everybody wants to see progress, wants to see things work better. There are more regulations on like the SNAP, 3 squares, benefits, qualifications for Medicaid. All that's going to require a whole lot more bureaucratic work. And I use bureaucratic in a neutral way, because it's a bureaucracy, but it's going to require a lot more staff time given our current IT setup. So the chances of for the opportunity to build IT will help us get through and adapt to some of these changes that are coming from the federal government. People say, well, maybe it'll only last for a few years, but in the meantime, those few years could have serious impact on families that we were serving. Now, just one last thing, I think this is probably most important, is the report I sent to you, which was also sent to your committee. So I don't know if you had already seen it. Re-envisioning the Agency of Human Services. This was reading this. I say the agency is really ready to redo how it works and to fully integrate services, but they need the right tools.
Is this the proposal that Ginny and Jane had about dividing the agency?
No.
It's a different.
This is a report out of Act 119,
Oh, right,
which
that's right.
Secretary Samuelson wrote, and there are structural options, agency operations, all kinds of things, including that Doug has mentioned more than once, the integration of a bunch of.
It's all about integration. It is a fabulous report. I've been looking for this since I left the agency, but I've had any opportunity. So I didn't really know what was going on. And when I read this, I was thrilled. The policy wonk in me says, this is a good report. It's serious. They talk to a lot of people. They right there in the front, the staff hours, 1,736 staff hours to put this together. This was not slapdash. This was a very thorough report on some of the changes are needed. And IT was underlies the ability to actually implement this vision. To me, it is the right vision. They need support, and they may need legislation. Senator, sounds like you've been through it, but there are proposals for a couple of some positions, a couple of deputy positions that has to come from the legislature. I mean, the governor can propose, but it's up to the legislature to fund those positions. And other management changes. Most of it's internal management, but they keep talking about integration and the need for information technology. So this is a great piece of work. I hadn't talked to them, but they've invited me to come and talk to the staff about this later on this week, just to talk about the process, because the process of making changes is really very, very difficult and very political. Every time you go to make a change, if you're moving dollars around, somebody is losing something. Okay. And that's really hard to do. And when I was doing it, sometimes the legislature would be supported, sometimes it wouldn't be, based on like losing positions or constituents who are running a program saying, geez, it's not, we aren't going to get the same amount of money because they're shifting priorities. But that's where we need, the two branches need to work in partnership. And one of the values of having community looking at this is understanding the management issues that have to be faced to make changes for the better. So I got a few recommendations for your committee, just for what it's worth. The first is to get Secretary Samuelson in here, and she was planning to, she'll be here next week.
Yeah. We'll have her in and we'll have, ADS's.
Yeah, about their role in this,
Yep.
because it's not clear that it's being designed with the vision that Secretary Samuelson and her staff have for the agency. And if they design it and it does a really good job on, A, B, and C programs, it may not do the X, Y, and Z that's needed for integration. And that's an issue too. And that with the vendors who develop these systems and bring them to the states usually want to sell you off the shelf things. Okay, they want, the big one is integrate eligibility. That's a huge one. It needs to be done.
Oh, be great.
One form.
One form, but they're
One
talking
form.
about it for DCF. Is it one form for Medicaid? Is it the same form to, be, the family eligible for mental health services? I don't know, but it could be.
A lot of the basics could be.
A lot of
I wonder, and this may not be a question that is answerable, but I would be really curious to know how much administrative time we are spending actually going through those forms. When the state of Vermont actually knows how much money everyone makes, they could just give the benefits to everyone eligible for them with no forms.
if the tax department could communicate with the Economic Services Division of DCF, they could.
Yeah. Because I feel like that would cut out a lot of administrative bureaucracy.
It's like, Office of Child Support. They have information too.
Yep.
And is that getting to the DCF reach out case managers who are working with the individuals who should be receiving child support and maybe are not? We don't know. I mean, there are issues where, somebody gets released, from one of our, correctional facilities. They go back where they came from in the home. Does the family know that this person's been released? Probably. I think corrections does a pretty good job of informing victims.
Yeah.
But does the reach out case manager who's working with that family know? And are they surprised when they go and do a home visit that there's somebody else living in the house now? And how does that affect the program the person's on? Has it had an impact on them? Are they still able to be getting an education? Are they, it just raises a whole lot of issues because we don't know from one program to another. So I would ask the secretary how their vision is being baked into the system. So the system actually enables them to do what we're talking about here today.
We'll have her in.
I would also suggest, Secretary of Agency of Administration, who I guess is coming in tomorrow.
Yes.
Yeah, who I think the world of. She was, when I was at the agency, she was the chief fiscal officer for the Department of Corrections. And then, Jim Reardon, who was the finance commissioner, stole her away to be his deputy. And I was in the process of stealing her back because I had a vacancy in the CFO of my agency. There was a retirement there. And just to add to the story, a little personal anecdote. We met for lunch next door or whatever it was, and I offered her the job. We had been talking, and I offered her the job, and she accepted it. And I did that at noon. At 2:00, I came over to the 5th floor and I got fired. So I never got to work. I never got to work with Sarah, but I think very highly of her. So, but I could ask her because that's where ADS and AHS or any of the other departments come together.
Yep.
And are they being coordinated? And if the secretary is agency administration is demanding it, it will happen because that's the greater of all the equal secretaries and commissioners. Essentially, one of the many bosses that I had when I was secretary. The other thing, there are recommendations in there for positions. I don't know what their position would be on asking for positions, because that's something that has to go up through the folks on the 5th floor before they can request them. But you can certainly ask them about that, whether they're needed, when they're needed. And ask what can the legislature do to make this happen? To be a partner with the executive branch. Oversight is important. I'd ask that you might want to they've got a plan and they're developing a plan, an implementation
Yep.
plan for this. Ask for occasional reports from them, just on the progress they're making, what they're encountering.
Senator Fox.
So, and you have been here, we do have a joint oversight, committee on IT.
Right.
Jai Talk, right? Anyway.
Yeah.
So
Yeah,
that
that's
also
right.
then could follow up and be, do the follow-up work.
Yeah, if they,
Or say,
they haven't met, they haven't met a whole lot.
They met quite a bit this summer.
It's last summer, I think, but again, it's one of those committees that it's hard to meet during the session and these projects are going on. I think it's important, that they're there. But what's their charge? Is their charge to look at, whether it's going to be functional for the Agency of Human Services to accomplish its mission? Or is it mostly focused on the budgets and timelines, which is what they really should be looking at? But where is it all coming together? Where are the pieces coming together? And that's why I think this committee is uniquely qualified. So I'll end there. I've been repeating myself a lot here.
That's okay.
I apologize for that. But there's an opportunity here to really improve state government, improve the outcomes for the clients of the Agency of Human Services, modernize our management, modernize our programs. We aren't the only ones going through this. This is every state, but we are one of only a handful of states that has an Agency of Human Services like we do. My counterparts, and when I go to these national meetings, my counterparts were mostly the equivalent of the commissioner of the Department for Children and Families, focused on children's issues and economic services and TANF program and all of those. One of my counterparts was in an administration. There were 8 separate agencies all reporting to the governor. And I said, how do you coordinate? How do you integrate? Well, we have quarterly meetings with the 8 of us. You know, that doesn't work. Or they have a children's cabinet where they can talk with each other. But we're talking here about day-to-day operations, and not just the overarching plans. So
Well, I knew you could fill 45 minutes, Doug, and you did.
happy to. I'm surprised I didn't park in front of me, so I have no idea where we were going.
I'm so glad you stayed engaged for this.
I just have a quick question, and you may have said it and I just missed it, but where did the stuff come from? Who produced
You
it?
know, I wish I knew.
Okay.
I kept looking for it myself. I think it probably. I file by files. And I have a whole lot of files on the Agency of Human Services. I stayed engaged. Like I did consulting for APHSA afterwards. I was down in Mississippi. You think we got problems here? Try going down to see what's going on in Mississippi. But I was involved in leadership meetings of the CEO, call ourselves CEOs of these departments. I was involved with, continue to be involved in it, but I kept picking things up as I go to these meetings. And this one was in the file. I probably lost the cover page, Senator. And that's, it's in there somewhere, but I have no idea. But it's about 10 years old. I
was gonna say, the one thing we're missing here is also a date, so.
Yeah, it's but the 10 reasons are still valid.
We're still strong.
Yeah, I think they're still strong. It's a way of making points. So I urge you to stay involved. I think you could do a lot of good just by asking the right questions.
Okay. Well, thank you for coming in today.
Thank you for listening. I appreciate it.
Well, thank you for staying engaged. It's great.
You know, it's important to me. I mean, you know what I'm working on for my time in politics. It's around kids.
Yeah.
And it's about families, and we need to support families. We had the Child Poverty Council many years ago. We could have called it the Family Poverty Council because children do not exist then. But in terms of the politics of talking about poverty, it's better to focus on children than it is. It's about PR too, a little bit. But you know, it's but my interest has continued, and when I was head of that agency, I thought there's a whole lot we can do better.
Yeah.
And I would say, I go to committees and I'd say, you've given me a box of money. This is how much I have. Don't tell me to raise taxes. I don't have the authority to raise taxes. Yeah, we'll talk to the governor about that. But this is the money you give me.